low, low. Bend over touching the toe and we right there behind them telling them go, go, go. Long time. I don't end up in a party all in a nice vibes. But I'm glad that I come out tonight. Not in the house like some of them ballers. I could definitely use a good fet right now. Definitely use a good fet right now. Fet right now. Fet right now. Definitely use a good fet right now. I could surely do it a good fet right now. Surely do it a good fet right now. Fet
Pull up, audio, pull up.
right now. Surely do it.
All right. Good evening, everybody. Good evening, everybody. Good evening to the regular people who line with us on a Sunday, and good evening to those who are joining us, especially for today. So you heard these. You heard the lyrics of that song. You could do with a good fet right now. Who could do with a good fet right now? All right. So my name is Mark. As you know, part of the Just Vibes crew. And normally on a Sunday, we have the Sunday Song Clash, which I know some of, or many of you have joined. Today is a little bit different and a little bit more serious. So of course, you know, it's not the regular, for those who are regular to the Song Clash, it's not the regular trolls and the regular jokes and that kind of vibe. It's a bit more serious, so we're going to be taking it a discussion on the COVID-19 vaccine. So as you know, many of us, if you live abroad, well, when we say abroad, if you live in the UK, US, Canada, there is access to the vaccine. Those of you who live in the Caribbean, Africa, Latin America, and various places, it's not really there yet. So of course, some of us have the choice, some of us don't have it as yet. So it's really a discussion. And again, as you saw, those of you that got the original flyer and so on, the real premise of today is the choice is yours. But if you're like me, I mean, you know, sometimes you're like in a WhatsApp group and you get like a forward, or somebody sends you a YouTube link to a person and you don't really know what to believe, if to believe that person. So what we thought, you know, just in conversation with friends and family, we thought we should have a bit of a conversation and discussion with people who know what they're talking about, right? So, I mean, you know, you could always do your own Dr. Google and search and so on. I might know a little bit more about Sound Clash, but our friends and family that are joining us today, they know a little bit more about the Corona-19 vaccine, or a lot more, as well as they know, you know, they're actual professionals in these fields, medical doctors and researchers. And one of our friends works for Public Health England. So of course, today is going to be a bit focused a bit more on the UK, but I think a lot of information on the vaccines in general and what's happening in the world in general will be relevant to you no matter where in the world you are. Okay, so with that being said, we're going to introduce our guests today. So we, you know, ladies first, we're going to allow them to introduce themselves. So we're going to head across. First of all, I don't know if we say Dr. Nutmeg or we say, you know, either way. So feel free to say a few words that people know about yourself.
So I am called Dr. Nutmeg. It's a name that a friend of mine gave to me a very long time ago when I had just finished medical school. And as you can tell by the nutmeg in the name, I am from Grenada. So my actual name is Claudine Ogilvie. And I am Grenadian born and raised. And I now live in South Wales. So I live in the UK. I trained in Cuba. For those of you who, I'm not sure if they're still doing that, but I got a scholarship to go to Cuba many years ago now. We won't talk about how old I am. And I went to Cuba, then I went back to Grenada briefly, then moved to Antigua before moving here to the UK. I work in pediatrics, so that means I work with children. I don't know a lot about adult medicine, but I am a trained healthcare professional, and I am here and willing, as somebody who has herself had the vaccine. My mother, who lives back home in Grenada, she has also been vaccinated. And I am here willing and ready to answer any questions. I do a lot of outreach work. I do some mentoring. So if anybody wanted to get in touch with me about that afterwards, I could always do that. But yeah, that's me.
Thank you, Claudine. So we're going to head across to Ibrahim. Evening, Ibrahim.
Right, evening. Hi, everyone. Good to see everyone here. Yes, as it says, my name's Ibrahim Wali, but got different names people call me. sometimes I get called Dr. Fett, just because, yeah, I do love my Caribbean music and culture, and I love the culture, although I'm from Nigeria. So bit of a background about me. I actually work in Epsom, Surrey, which is in UK. I work as a GP in primary care. I went to med school actually in Nigeria, which is where I'm originally from. Uh, I grew up in Lagos, lovely city by the beach. It's a bit of a crazy city, crazy life. Um, the university's been great there, but after the university, I came over to the UK. I did a bit of work around different specialties, actually, from A&E to general medicine. Started a medical training rotation, and then decided actually I'd love to go into primary care, work closer to my patients, and still be in touch with the whole of medicine. So I became a GP. I've been a GP now for 11 years, and still working in the same area, Surrey, UK. For the vaccines, I got involved, one, because I'm a GP and we get involved in delivering the vaccine to our patients or group of patients in our area. But I've always been interested in the vaccine because I've seen how bad the COVID was, and I've seen how many of our patients got affected as well, and how many people have died, or even if they haven't died, how many are actually suffering from the problems of COVID, like long COVID. So yeah, I did get involved. I did volunteer as well to do the vaccine initially when they're doing the trials. So I can talk a bit about that if someone wants to know. I didn't get the vaccine then because I somehow had some antibodies in me, but I can tell you all about that program as well and how that went. So I'm glad to be here, and I'm sure there'll be lots of questions. So I'm happy to answer any questions anyone has.
Cool. Thank you, Ibrahim, aka Dr. Fett. So sometimes in the Zooms we see Ibrahim with his jab horns and so on. Today, as we say, it's a little bit of a different event, but it's good that people from our community who actually have the knowledge and have the expertise can share with us. So another person from our community who has that knowledge and expertise, feel free to say a few words, bro.
Evening, everybody. So my name is Hamish Mohammed. I am from Trinidad and Tobago, currently based in South London in Brixton. And for those of you that know, I'm originally from a town called Tunapuna. So I'm Tunapuna born and bred. We have many fantastic people from Tunapuna, people like CLR James and Winifred Atwell. So people have left their mark on Britain and played a key role in raising Black consciousness and fighting for the Black community in Britain. So there's a really important legacy in Tunapuna. I'm an honorary member of the Exodus Steel Orchestra, okay? And as a result, I go to the Panyard from an early age with my father and hear the band practicing, and that fostered this appreciation for my culture, for the music. So again, grew up in Trinidad and Tobago, went to Morehouse College, or as it was known in the late 90s, UWI Atlanta, all right? And then moved to New Orleans to do my PhD in epidemiology. And in New Orleans, while seeking a bit of a creative outlet, while keeping my head down at books, I needed some energy to channel elsewhere. I started DJing on the radio, and I would play the music of the English-speaking Caribbean. So music from Dominica, Antigua, Barbados, Grenada, Jamaica, Trinidad and Tobago. I joined the sound system, Livication Sound International with DJ Uncle L, and really just enjoyed the sound life while actually focusing on the books as well. So my specialty on the PhD was infectious disease epidemiology. After that, I joined the Epidemic Intelligence Service at the Centers for Disease Control and Prevention. I went back to the Caribbean. I was in Puerto Rico and focused on dengue fever and worked responding to dengue outbreaks in Puerto Rico, in the US Virgin Islands. I then worked in St. Kitts for a few years, worked in Trinidad and Tobago again for a couple of years, and then moved to London and have been working at Public Health England for over 8 years now. My specialty in Public Health England is in sexual health. So at Public Health England, I manage the National Sexual Health Data Set. So, and again, much like we'll talk about here, one of the communities that's most adversely affected by poor sexual health is the Caribbean community in Britain. So as someone from Trinidad and Tobago, this is something that I feel quite passionate about, addressing that inequality. Now, I also am the chair of the medical board of NAS, a sexual health charity based in London, and an honorary senior lecturer at University College London. And I use these networks and these resources really to raise awareness about good health, preventive behavior. And over the past year, I've worked at Public Health England as a consultant epidemiologist, again, managing the national sexual health data set for England, and also one of the epidemiologists collecting data for COVID-19. And again, COVID-19 is new, and the data systems had to be amended rapidly at pace to be able to report on a daily basis how many cases of COVID-19, how many deaths due to COVID-19 have sadly occurred. So that's been a big part of my focus over the past year as well. And in that capacity, I was one of many people that contributed to a Public Health England report that outlined marked ethnic disparities and adverse outcomes due to COVID-19. So by that, I mean Black and brown communities in England are more likely to catch COVID-19. And when they catch it, they're more likely to be hospitalized and die from it. So again, like I said, as a member of the community, I think it's important to take the skills that I have, the craft that I have, and use the systems that we have at Public Health England to understand that disparity better. And of course, like Mark was alluding to, right? The issue is we have two pandemics, one of COVID-19 and one of misinformation. So I'm hoping that this session will get people on the right paths and direct everyone to the right resources so they can make an informed choice about the vaccination.
Cool. Thank you, Hamish. Thank you, Ibrahim. Thank you, Claudine. So people, just to let you know, so as you may have seen, those of you that follow the Just Vibes social media and so on, we did put out a call for questions, those of you that were joining today. So the format is going to take as follows. So we had 107 questions, either by email, Facebook, Instagram, which is a lot for an hour that we're trying to keep this, because, you know, of course, everybody's busy, attention span, etc., and of course the time of our guests. So we're going to try to keep to an hour. 107 questions. I want to shout out our friend Jessica, who helped us and, you know, really get 107 questions into some topics, some key topics. As you would see for now, the chat is disabled just because, you know, it's a bit like, I know some of you are used to the song clash where it's, you know, everybody's throwing talk and that sort of thing. It's not quite that for this part of the evening. So the chat is disabled for the moment. What we've tried to do is get those 107 questions, which, mind you, about half of them came today in the last 5 hours. You know, that's how it goes. So we try to get them to three main sections: introduction or background, followed by the vaccine itself, followed by after the vaccine. So for the most part, it's going to be me moderating, asking the questions to Hamish, and as well, Ibrahim and Claudine have bits to add in as well. We're going to bring them back a little bit later on. The initial part is going to be with Hamish. Then we have some other friends and colleagues who have already taken the vaccine in the UK, in the US, and they're just going to speak about their experience. So again, it's more discussion, keeping it open. You know, it's for everyone to make their informed decision. But I think, as I said at the beginning, you know, I receive so much different information from different sources, and sometimes you just don't know who's the source, where did it come from, and we're not as scientific to research and know exactly what's what. So I think we're very fortunate to have people who do. So without further ado, we're going to start trying to go through these topics and areas. So as I said, we're going to start with sort of introduction or background, followed by the vaccine itself, and then finally a little bit about what happens after, and, you know, some of the questions that people asked about after the vaccine. So I'm going to try to go through, and again, we're going to try to keep to an hour. We already know it's going to be tight, but we'll do our best. So Hamish, I think to start off, if possible, if you could just give us a really brief, I know everybody, most likely everybody said the word corona or COVID-19 every day for the last year. I'm assuming. But if you could just give us a little, you know, layman's, scientific, but layman's to what exactly it is and how it affects us.
Yeah, of course, we're very happy to. So the first thing to say is COVID-19 is an acronym. It's short for Coronavirus Disease 2019. The 2019 refers to the fact that it was discovered in December 2019. Coronaviruses, and again, there's this brand around corona and coronavirus, but there are many coronaviruses, and they cause a range of illnesses from the common cold to more severe outcomes and more severe disease. Now, the severe coronaviruses, the first that was discovered was SARS, the severe acute respiratory syndrome in 2002. And that was really, it spread like wildfire in certain healthcare settings. It affected over 20 countries, and 10% of people that caught it died from it. So SARS was the first coronavirus that was severe and raised this concern amongst the scientific and research community that we need to be prepared for any emergence of future coronaviruses that could cause severe manifestations. Now, everything kept quiet after that, but then another coronavirus emerged in 2012 from Saudi Arabia called MERS, Middle East Respiratory Syndrome. And again, similarly, spread very severe outcomes. People would catch it, end up with pneumonia, end up in hospital. A third of people with MERS, when they catch it, would die from it. Now, spring forward to 2019, when SARS-CoV-2, so the virus that causes COVID-19 is SARS coronavirus 2, and the 2 in that refers to the fact that it's the second severe acute coronavirus, okay? Now, COVID-19 in particular, speaking about the virus that causes COVID-19, it is the largest pandemic in living history for most of us. We have had pandemics going back for hundreds of years since recorded history. The last one was in 2009, H1N1 influenza, but it was not on this scale. The last pandemic on this scale was 1918 Spanish flu influenza pandemic, where 50 million people died. So again, that was a far greater, more severe pandemic. That's not to minimize what we're going through right now. So as it currently stands, every country or territory practically across the world has had at least one case of COVID-19. And the WHO, I'm just double checking my notes, the last case count for from the World Health Organization, over 4 million cases of COVID-19 and over 4.2 million cases of COVID-19. And wait, I'm mixing up my UK figures and my worldwide figures. I was like, wait, no, this song is way too low. It's over 110 million worldwide and over 2.5 million deaths due to COVID-19 worldwide. So it's led to massive social disruption, massive mental health, physical health impact. I think lockdown is now the word of the year for a number of dictionary entries. So that's part of our vocabulary, and certainly we in the UK are now in our third national lockdown. So it's become part of the daily dialogue, like Mark was alluding to.
So just to mention to people in the chat, if you have any questions, if you could just wait until the end, because again, we had over 100 questions, so we're trying to cover them through these topics. At the end, if you have any questions that weren't covered, feel free to type them directly to me. So another area that a lot of people asked about, Hamish, was how COVID-19 has specifically affected Caribbean and BAME communities in the UK and worldwide, and why is that? And on the flip side, how can we address that as part of that community?
So it gives me no pleasure to talk about this, but it's an important topic. So to answer that question specifically, now BAME, that acronym, BAME, it's something that's used in a lot of policy documents. It's not helpful because it lumps everybody into this category, but what it essentially is referring to, or many people regard it as people who are not of white ethnicity. So when we look at the Caribbean community in particular, in the first wave of COVID-19 in the UK, people of Caribbean ethnicity comprise 1% of the population, but there were about 2.5% of the deaths. So in other words, there's a disproportionality in terms of the impact of COVID-19 in the Caribbean community. It's a similar picture for people of African ethnicity, as in people from the African subcontinent, and people who are Indian, Pakistani, or Bangladeshi ethnicity. So essentially every ethnic group other than Chinese ethnicity had a higher rate of death due to COVID-19 over the past year. So what we've seen in terms of the Caribbean community is that our community is more likely to catch the virus that causes COVID-19, and after catching it, more likely to die from it. So again, it's a really serious state of affairs. And the reason for that is there are multiple factors, and you'll hear a lot of misinformation, a lot of theories about it, but the best evidence suggests that it has to do with the fact that our community is more affected by underlying health conditions that make your outcomes worse if you catch COVID-19. So by that, I mean diabetes, heart disease, kidney disease, obesity. So as a result of these factors, it means that if you catch COVID-19, you're going to have a more severe case of COVID-19 that might land you in hospital. So the root cause for these things, if I'm being quite frank, is the fact that people who are Black British live in the poorest areas of the country. And these areas are more likely to be densely populated, have overcrowded housing, and people that live in professions where they cannot work from home. So when the advice is to work from home and you are doing delivery or working in a manufacturing plant or you cannot do it. So you're in a position where you have to actually go out to work and you're unable to socially distance in the workplace or at home. So as a result, it's these kinds of socioeconomic circumstances that mean that our fate tends to be worse when we catch the virus that causes COVID-19.
So, of course, you deal more with England as working with Public Health England, but would you say that is reflected of the similar communities in the States, Canada, other?
You hit the nail on the head. You hit the nail on the head. So if you look at the data from Canada and from the US, people who are African American, for instance, in the US, are more likely to have bad outcomes, to die from COVID-19. So that's a consistent picture where you have that. And essentially what you look at in all societies, poorer people are more likely to catch COVID and to die from COVID-19. So that's consistent across a number of societies.
Right.
You'll hear many people make claims that it's a genetic reason. I think that is a cop-out, to be honest, because I think that doesn't address the fact that the socioeconomic circumstances in which we live, that is actually the challenge. That's what can be modified and can be addressed. So again, it's not any kind of predisposition to catching or dying from it. It's more about the fact that on average, we're more likely to be in a situation where we can't put those public health measures in place. We cannot socially distance, we can't work from home, and there's a higher proportion of people with those underlying conditions I mentioned, like diabetes.
Okay, thanks. So as we say, people, that's a little bit of a background for, first chapter, so to speak. Again, if anybody has questions, please hold on to them. Maybe take a little note, and it'll be useful to take notes as well to share, facts with friends and family. But at the end of the 3 sections, if you have questions, you can text them in to me as well. So moving on to the sort of second chapter, as we say, the vaccine itself. So for us who are not as scientific, and of course we see a lot on the news, we hear a lot of stuff on social media, but what is the vaccine?
So a vaccine is a substance that stimulates or triggers your body's immune response to recognize a particular bacteria or virus. And it means that your body's in a state of readiness. So if you encounter the virus, let's say it's the virus that causes COVID-19, you encounter that when you're out and about, your body will actually think it's encountered it before and rapidly mount an immune response and prevent infection. So that's what a vaccine is. And I just want to make a plug because the Caribbean region is the first World Health Organization sub-region in the world to eliminate measles. So we have a really successful tradition of vaccination, childhood vaccination in particular, things like MMR. Just, again, it's part of our success story in terms of the actual delivery of public health in the Caribbean. And that's something we should all be proud of. So we were the first to do so in 1991. The Caribbean was certified as measles eliminated. So again, we're fortunate to be from a situation and a setting where there is a tradition of adherence to vaccination, but there's a paradox because when vaccines work, you don't see the disease, okay? So then if a generation or 2 passes and people don't see cases of polio or smallpox, there are people on this call who will remember people who had polio and would need to be in iron lungs in the hospital and couldn't breathe. And again, that's their reaction, I think, is perhaps a bit different to vaccination. Whereas many of us who are, I don't know, under the age of 40, let's say, and I'm not under the age of 40, but just for the sake of argument, you wouldn't have seen a lot of these vaccine preventable diseases. So oftentimes the incentive or the motivation for vaccination is compromised. So again, what I do and what epidemiology is about prevention. Other than clean water, vaccination is the most successful public health intervention. And Well, that's my long-winded answer as to what vaccination is. Yeah.
Sure. So somewhat along those topic where you said, of course, people in this room are from all over. Some of us have traveled and had to take, say, a yellow fever vaccine or something else that we may have thought not much. We say, okay, that's what you need to go to that country. You take it. What would we say is is there anything that different to this new vaccine to someone who would have taken a yellow fever or other vaccine to travel, for example?
So the premise is the same. So the yellow fever vaccine or the influenza vaccine, the MMR vaccine, these all stimulate the body to mount an immune response. The underlying technology is to create the vaccine will differ from one vaccine to the next. So for instance, there are 3 vaccines currently approved for the UK, and 2 of which would be available in the Caribbean through the COVAX initiative, okay? So one of them uses what's called an mRNA, so messenger RNA vaccine, and the other one uses a viral vector. And these are just ways to have the actual genetic code for a protein on the surface of the virus, have our body create that so that it triggers that immune response. And the key thing to note is the license, at least in the UK, the approved COVID-19 vaccines do not contain viral particles. It don't contain the virus. You cannot get COVID-19 from the vaccines. But what the vaccines do is enable your body to generate a protein. It's called the spike protein. And again, it will trigger that immune response so that if you encounter COVID-19, you are less likely to have any kind of severe illness. Now, the good news is, and this is, I don't know if I'm getting ahead of myself, but tell me if you want to pull me back in there, Mark. So the key thing to note is, and this has been a source of some concern, the vaccines were developed very quickly because of the experience from SARS since 2002. So in a sense, it's been 19 years of the scientific community working in readiness to understand severe coronaviruses. The other thing is, science is an iterative process, so it gets better over time. And technology, as we all know, so your television, your computers will get better. The same stands for vaccine research. So we have learned from the experience with Zika virus, influenza, with Ebola virus, and the experience from those outbreaks and those pandemics, as it were, have improved the vaccine technology in a way that we could deploy and roll out vaccines faster than we could have 10 years ago. I couldn't imagine if it was SARS, I mean, we have a very different picture right now as in the original SARS virus. So the key thing to note is, if you imagine all the high income countries in the world have one single priority and invest hundreds of millions of pounds or dollars, as the case may be, into research and into trials. And the other thing that's happened in the UK and other countries is that the phases of vaccine development happen concurrently, whereas in the past, they would happen sequentially. So there are 3 phases of vaccine development. Phase 1 and 2 happened at the same time, starting last spring. 2 and 3 started in the summer. Results were available by the end of last year. The other thing that's novel is that various governments have invested resources in manufacturing the vaccines. So this is the first time you've had the concurrent running of the phases of the vaccine development and manufacturing of the vaccine. So as a result, we're in a position where the world is on the cusp of having these vaccines that could really dramatically alter the course of the pandemic, and I think resume a state of normalcy.
Cool. So 2 things there that you mentioned, I think a lot of people asked in the questions. One, does the vaccine have the virus in it? I think you alluded to, but just want to be clear for a lot of people who asked that.
Of course. So just to clarify, when I'm talking about the 3 vaccines approved in the UK, one is Pfizer BioNTech. The other is the Moderna vaccine, and the third is the Oxford AstraZeneca. The Pfizer and the Oxford AstraZeneca are currently being delivered through the vaccination program. None of those 3 vaccines contain viral particles. They don't contain the virus, and the vaccines cannot give you COVID-19.
Okay. And then the other, probably the biggest question, or the most frequently asked question from people who sent questions ahead, was how come they make this vaccine in a year?
Yeah.
And And sort of the second part of that is, they've had other diseases over years, but they haven't been able to find a vaccine for those. But this corona, they make it in a year. So a lot of people are a bit skeptical because it seemed like it was that quick.
Yeah, well, it is quick, it's unprecedented. But I would say, despite being quick, no compromise has been made in terms of assessing the scientific rigor or the safety of the vaccines. So what's happened this time that's different is, like, you'd remember that, and I'm sure all of you will be aware, we've never experienced a pandemic on this scale in living memory. I mean, there may be some people who would have been around in 1918, we're very old right now, okay? But most people would not have experienced anything on this scale in their lifetime. So again, it's a combination of the fact that SARS coronavirus 2, the virus that causes COVID-19, is very similar to SARS, the original SARS coronavirus from 2002. So there's been knowledge of this virus, a very similar virus, for 19 years, right? The other thing is, again, technology has improved to an extent that vaccine delivery or vaccine development can happen a lot faster than it could have. And the third thing, like I mentioned, is that, at least certainly in the UK context, and sort of happened in other countries as well, the UK government has essentially hedged their bet. They last year hedged their bets by investing in 7 different vaccine candidates while it was still in phase 1, the very first phase of clinical trials. And they invested such that the trials could happen in tens of thousands of people. So when we look at the clinical trials, the phase 3 clinical trials for Pfizer and for the Oxford AstraZeneca, we're talking something like 60,000 people across 7 different countries have been in these trials, with representation by gender, by ethnic group, by age group, etc. That happened, and they also built up manufacturing capacity. And they did that to ensure that we, at least those of us here and other people benefiting through the COVAX initiative, will be in a position in 2021 to have the opportunity to be vaccinated. So again, it's a collective effort in terms of investment of time and investment of resource, and running a series of steps that would have happened sequentially, running them concurrently. And at no point have any kind of safety compromises been made. There's a high degree of transparency, and there's an obligation to report any adverse events, to do so from the clinical trials and from the vaccines that are currently being delivered by the NHS.
Okay, so many different little questions from what we have.
If I can just interject.
Yeah, of course.
I think Hamish has done an incredible job of breaking down the science for everyone on the chat. But I think what I have found because I think I probably come across a lot of people with vaccine type questions because I work in pediatrics, and it's usually that age group of people that are being vaccinated, and parents that are normally skeptical and that sort of thing. I think generally sometimes the science can be a bit much for people. And if we are being honest, while the work that was put in by these vaccine developers was incredible and unprecedented, the way the government handled things like the rollout of the vaccine, the lack of transparency throughout the entire COVID, the entire pandemic, makes people incredibly skeptical. And one thing I'd like to say is that when it comes to the research, so the research was independent of the government. All of the trials, the studies were done by scientists who are putting their names to these things. And even if you don't trust the government necessarily, I would say trust that the science is true.
Thank you for that.
Yeah, Dr. Claudian, I completely endorse that. You're absolutely right. So it's not like the government has been doing the trials. So that hasn't happened. They've been independent entities, so academic institutions and pharmaceutical companies that have been doing it.
Okay, so just 2 bits I want to try to recap and make sure that I understand, and hopefully everybody else understands. So, of course, Corona-19 came around 2019. But is it correct to say so from SARS days in 2001, 2002? 2002, the vaccine that is currently available for Corona 19, they started making it essentially in 2002. And they've built upon what they learned, I guess.
They didn't start, they would have, at the time, they would have started developing vaccines for the original SARS in 2002. So they are genetically similar viruses. And I guess you ask a good question. I don't know the answer to it. There might be potential for the COVID-19 vaccine to offer some protection against SARS and MERS. I don't know the answer to that. But again, they're similar coronaviruses. And again, to clarify, it's because we had a coronavirus of similar epidemic potential, something that spread to 24 countries within less than 2 years and caused something like 20,000 deaths, which again pales in comparison to what we're seeing with COVID-19, but that's a lot of deaths from one virus in a short period of time. As a result of that, that incentivized a number of researchers to understand the virus better. And it means that we are now in a better state of readiness, such that COVID-19 has emerged and it's a genetically similar virus. It means that we've had nearly 20 years of science researching the original SARS to understand this virus and how to tackle it and to develop a vaccine for it.
Okay. And another question around what you said. So being that you work for Public Health England, you were saying that the government was investing in several vaccines, but now it's just, well, for now, 3 are approved. So how many vaccines were they looking at or working on?
Okay. So it was, the reason why the additional 4 haven't been approved is because they're still going through the clinical trial stages. You can think of like the Pfizer was the first out of the gate, right? The first out to report. It doesn't, and again, it doesn't mean that they compromise safety. They had the trial run its course. The last trial before approval is a phase 3 clinical trial where you give the vaccine to people, and some people, they're randomized, and they could either receive the vaccine or a similar vaccine or a saline solution injection. So they don't know what vaccine they get. And then they follow them up over time to see how many actually get sick with COVID-19. Mm-hmm. So that trial reported earliest. The Oxford AstraZeneca trial has reported, and the Moderna trial has reported as well. And on the basis of those results, the regulator here is the MHRA, Medicines and Healthcare Products Regulatory Agency, which again is independent of government, right? And advises government. They approved those 3 candidates, those 3 vaccines for delivery. There are 2 currently available, and Moderna is scaling up production to provide vaccines to UK, the rest of the European Union. Well, UK and the European Union.
Yeah.
Now, to answer your question about the other 4 candidates, we're waiting for results from those clinical trials. The Janssen vaccine has reported provisional results. And on the basis of that, some countries have decided to offer that vaccine already because it's looking like it's we say efficacious. It looks like a vaccine that works. And the benefit of that vaccine is that it's 1 injection only.
Okay.
The other 3 vaccines that I'm talking about now is an injection now and another one a few weeks later. So, you can see the benefits of a vaccine delivery program that only requires people to receive 1 injection.
Sure. Okay. So what you say is a little bit like, if you're betting on a football team to win, so they, instead of betting for just Arsenal, which happens to be the best football team for those listening, if you just bet on one team, or they bet on, say, 7 teams, knowing that they're sort of going to lose money, but hopefully one of those 7 are going to be able to give us coverage, I guess.
I think that's a really good way to put it. It is a lot like that. And in this case, 3 of those 7 candidates actually have been shown to work very well. Right. And 2 of them are currently available.
Okay.
Yeah. And cool. just to clarify, it doesn't mean the other 4 don't work. It just means that we're still waiting to see the outcome in the other 4 vaccines to see if those work as well.
So I think that's sort of somewhat tangential, but a question a lot of people asked, if trials are still going on now for the vaccines that are approved and people are taking. No,
they aren't. So okay. the last phase, the phase 1, there are 3 phases of clinical trials. Phase 1, you kind of understand the dosage of how much you want to actually administer in individuals. Very small, probably 20, 30 people. Phase 2 would be a few hundred people, where you try to look at any side effects. And phase 3 is when there's that design that I mentioned earlier, where you have tens of thousands of people, usually across different countries, and you give them either the vaccine that's being investigated, or some other approved vaccine, or a placebo. So a saline injection that doesn't elicit any kind of response. And then you follow them up over a number of months to see how many get sick with COVID-19. So the 3 currently approved vaccines are not undergoing phase 3 trials. Those phase 3 trials are concluded. And on the basis of those results, the approval has been granted by the MHRA. And it's been also granted by the Food and Drug Administration in the US. So I don't know which of those 3, but I think all 3 and the Janssen vaccine have been approved by the FDA in the US as well.
Okay. So, and just to clarify, somewhat on Claudine's point, so there are separate entities that also look at it, not just government, because I know some people feel like, oh, it's just the government's doing it. So there's other people that look at the testing.
Yeah, in fact, there are a couple of ways. There are a couple of ways to look at it. One is the actual approval is through the MHRA, which is that independent entity that advises government. The other is there's an independent, I can't remember the acronym, there's an independent group of scientists that will access the data from the trial to look at how many people have adverse events, whether or not it's working well. So in some instances, you find that clinical trials will stop earlier because it's unethical to not give everybody the intervention. You know what I mean?
Right.
So an integral part of the clinical trial process, and it is governed by good clinical practice and a number of ethical principles, is that you can't do harm knowingly, right? Because it's simply not an option. They've had too many atrocities going back decades ago where the scientific and the research community simply will not perform ethical research. Any of you that work in science will know the rigor through which we have the research ethics process, where they assess risks and benefits. So there's a number of checks and balances. The first thing is, like Dr. Claudine alluded to, right? She said the independent entities doing the research. Secondly, the independent professionals evaluating the data and looking at the incidence of how many people get the disease and any adverse events. And then the approval is happening through the MHRA as well. So there are a number of different steps where you have that degree of impartiality to say, well, this is a new vaccine, it's shown to work.
Gotcha.
And if I could just make a point, there's something that, and I saw I know this question came through, and it's something a lot of people have asked before. In science, it's, I don't know how to refer to it. So scientists oftentimes don't sell themselves very well. So what you'd find is from the clinical trials show evidence that the vaccines reduce the risk of being sick with COVID-19. But when people catch the virus that causes COVID-19, a third or a half of them have no symptoms. Of the remaining half, most of them have very mild symptoms. And then you find it's something like in the UK, 2 to 3% of people diagnosed with COVID-19 die from it. Similar proportion when you look at WHO numbers. So the question has been, if I get the vaccine, I won't get sick with it, but will I get it and pass it on unintentionally? Can I still transmit it, not get sick and transmit it to someone else? And the fantastic news is there's been a research study called the Siren study that's taking place in something like 40,000 healthcare workers, NHS workers. So they are working in a setting, and Dr. Claudine, Dr. Ibrahim will know they're in settings where they're at higher risk of catching COVID-19 due to their professions, right? So when they look at people working in NHS trusts and they're taking tests every 2 weeks, this study has been able to look at whether people get asymptomatic COVID or actually get COVID-19 disease, severe or mild. And the brilliant news is, based on the data from, Pfizer's been available to healthcare workers since the 8th of December last year, just a few months ago. So based on the initial data, there's clear evidence of an 86% reduction in the risk of asymptomatic or symptomatic disease. So what that means is there's evidence to show that the Pfizer vaccine actually stops transmission as well as prevents disease. So I think a lot of people would stop and say, you're optimistic as a vaccine, but then you're getting advice to say, hold on, the vaccine doesn't mean that you can't pass it on. We don't know that yet, right? The clinical trials are focused on looking at disease and not people that have the infection with no symptoms. So you'd have to wait for what's called real world data. And there been 20 million people vaccinated as of yesterday. So a lot of people have received the vaccine. So we are looking at that. And the fantastic news is amongst healthcare workers is clear evidence that if you have the vaccine, after you have your second dose, the second Pfizer dose, they'll have an 86% reduction in the risk of actually being infected. So that means you can't transmit COVID-19 if you have the 2 doses of the vaccine.
Okay, so actually preventing getting and
exactly.
All right. So I think that was a major question as well from a lot of people, if it helps prevent you getting, or is it just the symptoms of? So
well, to clarify, the clinical trials looked at getting the symptoms, having severe symptoms, mild symptoms, or dying from COVID. But now that we've had millions of people vaccinated, and the same things happen, we know from the experience in Israel as well, that 2 things have come out in Israel, and they're clear in the UK as well, is that amongst the older people that have been vaccinated, the rate of decrease in deaths is faster than the rate of decrease in deaths in all other age groups. So there's clear evidence going back for the past 2 months that the drop-off in what's known as the mortality rate in older adults is faster. And the only difference really that's happened in that age group is that they've been offered the vaccine and they've taken up the vaccine. All right.
So is that 80 and above or 70 and above? What age was that?
The initial drop was in 80 plus. We started with 80 plus in healthcare workers and went down to 70 plus. And I think now it's 56 to 59. So it's going by age, it's going down in age group. And to clarify, the reason why it's done by age group is because the highest risk factor for death when you catch COVID-19 is being older. So people in the first wave in England, people who catch COVID, if you're 80 years or older, your risk of death from COVID is 70 times that compared to somebody who's 40 or younger. So it's a really, it's a terrible virus because it really impacts heavily among the oldest in society.
Okay. So another common question, which maybe either of the doctors may want to chime in as well. People asked, they say, I never take the flu vaccine. I haven't taken it for years, and I don't really get the flu. So why should I take the COVID-19 vaccine? What's the benefit of doing that? If every year I'm good, I don't take the flu vaccine, and I'm good, why should I take the COVID-19 vaccine?
I get asked that question a lot, actually, mostly from my patients. And the reason, I give them an answer to say, one, the COVID pandemic is quite a big thing. A lot of people are being infected. A lot of people are asymptomatic as well, and they're transmitting the virus. So it's not just about protecting yourself, but it's about protecting others as well. So you might be one of those that gets an asymptomatic COVID infection, but then you pass it on to your friends, to your family, parents, and that other person could suffer a severe disease. So the whole point is we want to control this pandemic. We want to restrict it, shrink it down onto sort of a baseline level. I think COVID is going to be with us forever. I don't think we can ever get rid of it. It will come back probably on an annual basis, similar to the flu. There'll be mutations, and people will get it at different times. So the important thing is we want to all get vaccinated initially to control this virus. Yes, some people, never get the flu jab and they don't catch flu, but it might just be a factor of luck. They haven't been exposed to the virus. It may be that they have got a better immune system. So maybe nutritionally they're better, maybe they're physically fitter. So there are reasons why, similar to why someone would suffer more from COVID than someone else. Someone with the flu may not have symptoms as well, so similar to COVID. So I think the key thing everyone wants, why everyone wants to be vaccinated now is really to shrink this pandemic and to stop the spread of COVID. I think in the years coming forward, I don't think everyone will need to be vaccinated, but that maybe then they'll look at the highest risk groups. But for now, we want to get rid of it and control and get lives back to normal.
Okay, gotcha. So maybe somewhat the flip of that point, some people asked, again, the whole idea is the choice is yours. Everybody chooses what they want to do, and lucky for us in some of these, where we live or the States, Canada, etc., you have the choice. Some people don't even have the choice because it's not there yet. Some people have asked, surely it's not for everybody. Who should not take the vaccine? And sort of the flip of that as well, people have asked, and Hamish alluded to some of the disease that's in our community, whether it's obesity, diabetes, is it recommended, or is who should not take it, if anybody should not take it, that is.
So there are each of the vaccine manufacturers. So there are two resources, right? So the Public Health England has published the COVID-19 program documents, and on that they have the protocols for each of the 3 currently approved vaccines. And on that there's a transparent way of presenting all the details, including who shouldn't be vaccinated. And I'll also share with yourself, Chan, some a resource to that link. So I'll send that link, and I'll send another one by a charity that's come together to kind of promote proper information and facts about COVID-19 vaccine. So when we look at the vaccines, it shouldn't be given to people in which there's no evidence of an effect. So what that means is the clinical trials focused on people either 16 or older or 18 or older. And that's because of the fact that COVID-19 most adversely affects the oldest in society. So that's a long-winded way of saying if you're under the age of 16 or 18 for the different vaccines, you shouldn't be offered the vaccine unless you have, and Claudine and Ibrahim could weigh in if they'll have their own experiences here with this as well. But if there's some other underlying health condition, the clinician might make a judgment to actually offer the vaccine. But as a default, if you're underage, you shouldn't be. The other group that shouldn't receive the vaccine is pregnant women. And that's because there were not pregnant women in the clinical trials. There's no evidence to suggest that there's any adverse impact if you're pregnant. But at the same time, because the clinical trials did not include pregnant women, that's the other group that shouldn't be offered the vaccine. And then the last group is anyone who has a severe allergic reaction to any ingredient of the vaccine. And the ingredients of the vaccine are published on those 2 links that I'll send through to Mark.
Okay. All right, thanks. So people, if you sign up via the Eventbrite link, we will send you an email with the information as well. If you want to just, email us at us, we're happy to share the links that Hamish sends through. So for now, we've sort of completed, the background, the vaccine. What we like to do here is just bring in 2 of our friends, colleagues who have taken the vaccine. So also DJs that you may have seen in the Clash or Soca Berlin last week and things like that as well. So just to introduce, and I don't know, either you guys want to speak first or after Shep and DJ Rascal. You guys both had the vaccine. How did it go? I mean, I haven't. I've not been called up yet, but you guys let us know how that was for you.
Yeah, I mean, good night, everybody. Thank you for having me. Everyone here who might not know me, I'm DJ Shep Beats, one of the residents for Bus Pepper, owner of Rocket Up Promotions, etc. Yeah, so I had the vaccine about 6-7 weeks ago now. And again, I was offered the Pfizer vaccine, which funny enough, that's the one that I wanted to get, just based on the results that I was hearing with people not getting adverse side effects from that one. I think my friends who've taken the Oxford AstraZeneca one, they were having some kind of side effects, whether it was a night. I know someone who had a week of side effects, but the Pfizer one was reporting a lot less side effects, if any at all. So I had the Pfizer one, and it, funny enough for me, no side effects whatsoever. So, other than the sore arm where the needle went in, there was nothing that I could note happen to me, no changes. Didn't grow a green head, right? or get any superpowers or anything like that, right? So, and I think it was important for me to do it as well. I think in my family at the moment, my brother-in-law, he had a double lung transplant 3 years ago. So for me, it was about protecting others more than me getting sick. You know what I mean? And I think Dr. Mohammed talked about it just now, about the fact about protecting others as well. And I think we have a duty of care to people, just as people, and as human beings, we do have a duty of care to people that we love and to make sure that we're not passing it on. Asymptomatic is a big thing. And, you know, I may get it. I'm generally healthy. I probably haven't had a cold in about, I don't know, 10 years or so. But, you know, doesn't mean that I wouldn't be asymptomatic. And the fact of knowing that I could pass it on to someone close to me and close to my family who had a double lung transplant who might not recover from that was a big deal for me. So I was like, sign me up first, you know what I mean? And I was there to take it. I wanted to take it the first to be offered. I wish it could be me. So that's my experience. Don't know what Rascal has to say about that, but that's my experience so far.
Can you hear me correctly, right?
I think you need to turn up your mic a little bit.
Yeah.
How about now?
Ooh.
Yeah, that's a serious piece of feedback there. Yeah, well, everybody that know me, DJ Rascal, resident for Just Vibes, and just all around good guy. um, Basically, I took the AstraZeneca. I was offered the AstraZeneca vaccine, but I have underlying health conditions, so I knew I had a reason to take it. I have diabetes. I've been suffering with diabetes for about 3 years now, genetically passed on from my family. They've had it for years, so I had to take it. But, you know, especially as my day job basically is I drive trains on the underground, so I'm highly exposed to it, especially with my, as I said, underlying health conditions. I think I should be able to take it, and I took it. And I've had no after effects at all. As Shep told you, he took the Pfizer, I took the AstraZeneca. No symptoms whatsoever except for the sore arm, and I've had it now for 3 weeks and have had no after effects. As Shep so eloquently put as well, we're not just doing it for ourselves, we're doing it for, our friends and family who might have underlying health conditions, people who might come into contact with that we don't even know might have underlying health conditions. If we get in contact with them when lockdown finishes in, the next couple of days or weeks that's coming up, you never know who you might pass in the grocery or something like that. You might pass it on, you never know. So I think it's our duty to actually be vaccinated as well. You know, just my point of view. If you, as the whole thing is, the choice is yours if you don't want to take it. But for me, I'm pro it. I'm pro for it all day.
Cool. Okay, thanks guys, and hopefully we see you all DJing on here sometime before lockdown lifts.
Well, if you'd like me, I could do it right now tonight.
Well, yeah. After the after discussion party, we'll be there.
Of course.
All right, thanks a lot for coming through, guys. All right, so Hamish, that's it. I mean, that's two guys who had it thus far. Of course, like you said earlier, sometimes you don't see, those who don't take it, they may still have the benefit, but we're looking at those who've done it and, sort of gone through the process. So moving on to the third section. As we said, we're trying to keep it to an hour, but so we go. So the third section of our little discussion today, trying to moderate through, is after taking the vaccine. So one of the biggest questions, which I think is also one of the main reasons why people would want to take the vaccine in terms of, their own lives. After taking the vaccine, can I live my life like it's 2018? You're going everywhere, you're partying, you're fetting, you're traveling, you're hugging your mom, whatever it is that you used to do in 2018. Can I live my life like that again?
So the first thing to say is I can't stress enough how much of an impact COVID-19 has had on all of us in terms of movements and how we interact with friends and family. The short answer is no, not yet, unfortunately. And the reason why I say that is because in as much as the vaccines will be, and again, the figures are quite promising for the 3 vaccines approved in the UK. So the Moderna, the Pfizer, and the AstraZeneca. So we're talking like 95% reducing the risk of disease, and that the healthcare worker study I mentioned is showing 86% reduction in transmission. But what that means is you have a small proportion of people that can actually pass it on. So until, I would argue, you have high levels of vaccination in people who are very likely to die from COVID-19 if they catch it, there will need to be some kind of measures, some kind of public health measures to restrict how much mingling we do. Once we achieve that level of vaccination, and the term you would hear is herd immunity. Now, herd immunity is a proportion, well, to take a step back, any infectious disease only spreads if you have people who are susceptible to it. So when you start up with COVID-19, the reason why COVID-19 has caused a pandemic is because nobody prior to December 2019 had any kind of immunity to it. So the entire global population, 7 billion people, are in theory susceptible to COVID-19, infection with the virus that causes COVID-19. So what you need is a pool of people that are susceptible to the virus to propagate a virus and to cause an outbreak or a pandemic. Once you achieve a certain level of immunity, what you'd find is cases start slowing down. So if you look at all over the world, so let's just take the UK, for example, we had a sharp rise and a drop, the first wave and then the second wave. So you'd find epidemics burning out, or once you introduce public health measures like a lockdown, you'll find the wave eclipse, it'll go down and start going down, and it won't go back up until people start going out and about again. So what it means is, at least in the short term, until we have, I would say, at least 80% of the population vaccinated with one of the COVID-19 vaccines, there will be a need to maintain those public health measures. And by that, I mean the washing your hands, wearing a face covering indoors where you can't socially distance, and social distance once you're outdoors, right? Now, and of course, the other measures, if you have symptoms, you go on the NHS website and order a test, or if you don't have symptoms, you go and get one of the rapid tests that are popping up all over the place. So you could get rapid tests, get results back in 30 minutes. So that is a short-term measure, but I will say, I think we're seeing light at the end of the tunnel, and we will be in a position where these restrictions will be eased. Those of you that are in the UK will know that the government has published a roadmap, and they're hoping, if 4 tests are met, the first of those 4 tests is the vaccine program is deployed successfully. That's the very first of the tests. If those 4 tests are met, that social distancing restrictions in the UK will be eased on the 21st of June. That's the aspiration. But again, to clarify, that is the earliest possible date, and it's only if those 4 tests are met. So it's very important to get vaccinated, because the only way to protect yourself or to protect others is through the vaccination. The only alternative to that is to stay home and not go out at all. And quite frankly, that's not an option, right? We've all dabbled with this in and out of lockdown, various countries, and that is not a long-term fix by any stretch of the imagination. So COVID-19 vaccination is the best way and the only way to resume a state of normalcy in society.
Okay, thanks. So kind of maybe somewhat controversial. Of course, you work, Public Health England and so on. Someone asked if the UK is opening in June anyway. Again, I know you just said it's a hope, and if certain things are ticked. Some people think June 22 is the date. Everybody loose, biggest fete ever. If the UK is already opening in June anyway, why should I get the vaccine?
So again, that's a good question. So the government has published 4 tests on their website that would have to be met in order to actually go ahead with that date. So that date, they've used it to indicative dates. So what in practice that means is the earliest possible date. So they're doing it in phases where they're opening up and easing restrictions across 4 stages rather. And the last would be stopping social distancing. So that's the earliest possible date. And I would say for that to happen, that's contingent upon most people in the population accepting the vaccination if offered. So yes, the choice is yours. It's not mandatory. There's no compulsory vaccination in the UK. Vaccinations are given through informed consent. But at the same time, we need to have that minimum threshold. We need to achieve herd immunity in order to really dial back on the social distancing guidelines. Because if not, what you'll find is there will still be COVID-19 cases, and people who have diabetes, heart disease, they're older, people from the Caribbean community will suffer and will be in hospital, and they will die from COVID-19. So I can't stress enough how important it is to get vaccinated.
Okay. So another big question from people, probably this and how come they got the vaccine in a year, were the 2 biggest ones. What are the odds of me getting seriously ill or long-term illness from taking the vaccine?
Okay, that's an important question, quite frankly. So the phase 1 trials for the vaccine, well, to answer the question, they're very low, firstly. So the phase 1 trials for all the vaccine, for the 3 approved vaccines here, started last spring. All those individuals have been followed up. There have been 21 million people vaccinated since the 8th of December, and all of them are followed up by their medical practitioners. Well, I should say they can report any adverse events to their medical practitioners. In addition to which, in the UK, there's a scheme called the Yellow Card Scheme that's operated by the MHRA, whereby individuals or healthcare providers can report any adverse events. Now, both Shep Beats and Tariq had mentioned the fact that they had a bit of a sore arm after the vaccine. So what is common, every medicine, every medical intervention has a risk of side effects. That includes ibuprofen and paracetamol, right? So with vaccination, and COVID-19 vaccination is no different, what you'd find is people will experience some side effects. The most common side effect is soreness where you were injected, right? Your arm might feel a little heavy. And then a smaller proportion of people might feel a bit achy. They might feel a bit of fever, you know, they might feel a bit down. Most instances, those only last a day or two. But I think it was Shep Beats who said there will be some people who it'll last a few more days. But believe you me, that is far better than ending up in the hospital and needing a respirator because of having COVID-19.
So would you say the vaccine is like a seatbelt? Like, you know, sometimes you hear, yeah, well, you know, my brethren drive from Manchester to London with no seatbelt and he didn't get in a car accident, he didn't die. But I guess if you wore the seatbelt, you're more likely to not, well, maybe not die, but, you know, not get any serious harm. Is it, I mean, is it a comparable?
Yeah, that's another good analogy. I completely agree with you, because I think there's so one thing I want to say. I mean, there's a perception that if you're young, fit, and healthy, that COVID-19 is no big deal. Now, I would challenge that, because COVID-19, we've only known about it since December 2019, and a lot of people that have had COVID, and some people that had COVID asymptomatically, have developed what's known as long COVID, and for months after the fact, they still are not quite themselves. The term they use is brain fog. They can't focus. They feel fatigued. They can't do the same exercises they could have done. And that's happened to young, healthy people. So I would argue that it's in everyone's interest to reduce their risk of COVID-19. We should take it seriously and take whatever measures we can to reduce the risk of catching COVID-19.
Okay, thank you.
Can I comment a bit about that?
Yeah, of course.
I've had the same patients coming in after the vaccine with side effects, as Hamish said. The key symptoms, the side effects, are just an achy arm, headache, maybe bit of a fever, feeling tired. So 1 or 2 days. Some people, it's been up to a week where they felt like that, but these are probably people that tend to suffer more as well because of underlying health problems. It's definitely much better than catching COVID. And that is the key message I think one needs to know. People getting COVID can get long COVID. And I think, if I'm correct, it's about a 10% risk that some people may go on to have what they call long COVID. Now, long COVID is a bit like chronic fatigue syndrome. That's what we're seeing, is very similar type symptoms. So people complain that they're still being tired months. You know, someone who had COVID in March last year, they're still tired. They can't go back to work. They're having headaches. They're feeling low, depressed. You know, they're having brain fog, memory problems. And these are things we're discovering with COVID. And I think the key thing is, nobody wants to have that. And I think that was one of the things immediately, you know, you want to look at long-term. So people say, what's the long-term problem with the vaccine? Actually, very little or nothing, because the vaccine doesn't even stay in the system for long. It's actually your immune response. So if you're going to have a problem with the vaccine, it's a problem that is triggered by your own immune response to the vaccine rather than the actual vaccine itself. So I think that is the message, you know, if you get the vaccine, risk is lower than than if you get COVID, and nobody wants to be getting long COVID. So, and there's a lot of information online as well from sort of the World Health Organization and also, you know, Public Health England and Gov UK, and I think all around the world there will be information on this. So it is key to do that. I had the Pfizer vaccine, and I think I just had an ache in my arm for a couple of days, and that was it. Waiting for my second jab, so I'll be able to feedback on that. But I think if it's something that you need to know, just it's an informed decision. So everyone makes that decision to have the vaccine, and then if you make that decision, go for it.
Cool, thank you. So probably the last big question we had, and like I said, it was 107 questions, and we try to bring it into this hour. So trying to get it together. The next big question that people asked was, which, again, we're talking a bit on a UK side, of course, all our friends who are listening around the world as well, but from a UK side, the 3 that are approved, people want to know, which do you recommend? Which is the best? Which one should I take? What would be your opinion?
So for me personally, the first vaccine I'll take is the one that's offered to me, because all 3 are safe and all 3 have been shown to work. But what you'd find is the NHS supply chain might dictate that people in certain areas might have, I actually don't know the answers as to which vaccine centers are getting Pfizer or the AstraZeneca. Again, Moderna won't be available until the spring. So we're a little way off from the Moderna vaccine being available. So as it is, there are 2 vaccines currently on the NHS. So they're both shown to work in clinical trials, and they're both shown to work in the real world. So I would say vaccination with either will dramatically cut your risk of being sick with COVID-19. And that is far better. Again, that will ensure we hit that herd immunity threshold. It will increase the likelihood that we could go ahead with that 21st of June date, right? And the easing of social distancing restrictions. So I would argue we should make an informed decision. We should look at the resources and understand the differences between the vaccines, but they're both safe and they both work.
Okay, cool. All right. So,
If I can,
yeah.
sorry. So I've had both of my vaccines. I had the Pfizer, and if you can see, I know you can't see my legs, but I promise you there's only 2, and there's only 1 head, and I'm still walking around. I'm still fine. And my mother, who's in Grenada, she had the AstraZeneca vaccine because of, I'm not sure how much people know about the vaccines, but there are issues about temperatures at which they can be stored. And so there is no way in Grenada that they have the ability to maintain temperatures of -70, -80, -90 degrees Celsius. So they just can't have the Pfizer vaccine. There's a cost factor and that sort of thing. But for me, the important thing was, I know that my mother has heart disease, and I am here in the UK and I can't go home. And I need to know that she is protected from something that has been killing people left, right, and center. And there's something that Hamish didn't say earlier about when it came to talking about how. Hello, am I still talking?
You're there. You're there.
Can you still hear me?
Yeah, we're hearing you.
Okay, all right. When it came to talking about how Black Caribbean people are being affected disproportionately, and like one of the DJs that spoke earlier said he works for the transport system, and obviously I work in healthcare, and so does Ibrahim, and so does and we do a lot of people facing jobs, and my mother does a people facing job as well. And one thing that that was highlighted as an increased risk factor is the viral load. What that means is the amount of exposure to the virus that you have. And obviously, if you out here in the street, like we have to be because we're working, or if you're out here facing patients every day, even the people that are asymptomatic, you are having repeated exposures to that virus. And therefore, your likelihood of not just getting sick, but getting very sick. And that's why they thought that was one of the things that they that was presented as a reason for ENT doctors, so ear, nose, and throat consultants very early on becoming some of the first doctors to die, because they're constantly right down, inside your throat, right down inside your mouth, and they're doing what we call aerosol generating procedures. So they're doing things that create tiny, tiny droplets that are going into their airways, and it is that level of exposure. So I would say personally, if you are in a the type of environment where you're taking public transport every day, like so many people that live in London, where you are working in any kind of person-facing job. So whether that be hospitality services or transport services or healthcare services, you are at risk. And that's the long and short of it. You are at risk, you are likely to be sick. And if we talk about, like, I work for healthcare, and if we're going to talk about all the good things that have happened with the vaccine development and all that money, we need to also talk about the fact that for a lot of diseases, for a lot of conditions, for example, giving birth, Black people are much more likely to die. And a lot of that has to do with institutional racism and us not being heard or not being listened to when we have symptoms. So that means that there is more likely to be a delay in your treatment. And anything that could prevent you from having to go through any of those things, I would say, take it. That would be my personal 2 cents as a doctor, as a Black person, as a Black woman, and as a Caribbean person.
Thank you, Claudine. Anything to add, Hamish or Ibrahim? I think we'll, if you guys have any closing remarks at this point, or remarks at this point, and then we'll open for some questions from the audience.
I just want to ask one question to all the doctors here. Just one question to ask.
Just turn up your mic a bit, Rascal.
Yeah, I just want to ask one question to everybody, just to find out.
You still need to turn up your mic a bit, bro.
Hold on. Yeah, you can hear me now?
Yes.
Right. Just want to ask one question because, yes, just to expound on what Hamish was saying when he was talking about he didn't know what areas that were supplying whichever vaccine. My wife and I both went to the same clinic and we both got different vaccines. So she got the Pfizer, I got the AstraZeneca. So, I think it's just a luck of the draw, whoever gets which one at a time. So I think that just continues there. Just a quick question. When it comes to the virus right now that's going around and stuff like that, they said, the end is near and stuff like that. What do you think it will ever come to a situation where it would be just like the flu jab, where we have to take it almost every season, where it's coming down to winter and stuff like that? Would you have to re-up on it and stuff like, because people's immune system might not necessarily be the same. So they said it might, as Dr. Wally said, it will be around for a long time. So will it have to be a point in time where we'll have to re-up or get a booster shot to make it immune to it, continue to be immune to it?
Yeah, so I think that's the question on everyone's minds, right? The short answer, I think, is yes, because what we know so far is the immunity lasts at least 6 months, right? So what that means is what you'd find with any kind of virus spread through coughing and sneezing, they tend to pick up in the colder months, right? So you have a flu season, there will likely be a COVID-19 season as well that starts in the autumn and goes until the cooler months of the spring. So in my view, I think we're in a situation where the COVID-19 vaccine will offer immunity, but it's highly unlikely it'll be lifelong immunity. It'll more be in the order of potentially, we don't know the answer, to be honest. We don't know yet how long immunity lasts. We know from people who've acquired COVID naturally, it's at least 6 months. So there's been studies in healthcare workers. And because COVID-19 is so new, we don't know the answer to it yet. We don't know if people can actually be protected if they've been vaccinated for a year or 2 years. So in the interest of applying a conservative approach and maintaining herd immunity, we might be in a position, I think we're quite likely to be in a position where we'd be offered annual COVID-19 boosters. And the other reason why I think that is because the virus that causes COVID-19, like all viruses, it mutates. As many of you know, there are variants under investigation and variants of concern that transmit more easily, right? So to ensure that any of these mutations don't escape the target for the vaccination, there might be an additional need to have that booster. So I think no one knows the answer for certain, but the UK government has bought something like 350 million doses of vaccinations, right? And part of that planning of the vaccine task force will be to make sure every adult can have the vaccine, but also I think in preparation for providing a booster when winter comes around 2021.
Okay. Thank you. All right. So, any other, before we open for questions, anything else that any of you would want to say, or, summarize anything that was said before, any points that either the doctors feel could be expanded on or brought home, or are we good to go for questions?
I can just do a quick one about because
Yes, sir.
I am involved in the vaccine delivery locally as well. So where I work, well, we also do some of the vaccinations at the Epsom Downs Centre. It's a massive race course. So we've got both vaccines, both the Pfizer and the AstraZeneca. Storage, it's different. So for the Pfizer vaccine, once it's out of the -80, then we've got a period of about 5 days to use it up. So, and it can be kept in the fridge between 2 and 8 degrees. And it's a multi-dose vial, so you can take multiple doses from one vial. So it depends on what's coming in to supply. So we kind of have an idea, maybe even just the day before, of what's coming in. So really, as patients come in, you don't really get a choice of which one. I think just take whichever one is available. That is the key thing. That's one of the things to note. The reason why the AstraZeneca vaccine, is used in other settings, for example, we go into care homes, and that is easier to take the AstraZeneca vaccine because you can keep that in the fridge, and then we can deliver it locally to the care homes as well as people who are housebound. So there's some really unwell patients that cannot leave their homes, and the only way to get the vaccine to them is to go in there and give it to them. So that's another way to, that's why, so it's a good thing that there are two different vaccines, and, the storage kind of helps in terms of the logistics and how to get them around. I think that's all. The other question I think a lot of people ask is, what is the effect on how about pregnant women, and why can't pregnant women have the vaccine? I'm not sure if we covered it properly. There hasn't been shown to be any risk. It's just that the vaccine trials didn't involve pregnant women. And I think the Royal College of Obstetricians and Gynecologists have advised that the vaccine can be given to pregnant women if, one, their job, or whatever they do puts them at a high risk of contracting COVID. So for example, healthcare workers, and if they have an underlying health problem that might make them at risk of severe disease. So it could be given to pregnant women, but although it does not stop, and I think part of the trial, some of the women also got pregnant, in I think up to 33, so it does not stop pregnancy happening, which is another question that I get asked a lot.
Good point. We need to know that as well. Just somewhat on that point, someone asked, what about women that are breastfeeding?
Again, there's been no harm. So it's advised that breastfeeding women, as long as they meet the group criteria for having the vaccine. So at the moment, probably they will have to be higher risk to be able to meet that criteria, or living with someone else who is high risk. But there's no harm to pregnant women. The vaccine itself does not go into breast milk. It's an immune response. Yes, the antibodies could be expressed in breast milk, which may, theoretically provide some mild protection for a baby, but that's just a theory. But there's no harm to pregnant breastfeeding women having the vaccine.
Okay. Look like Claudine wanted to say something on that point.
I was gonna, but Abraham covered it.
Okay.
It is that, so there's often a lot of worry around things like breastfeeding, but some medications do cross, do enter into the breast milk. But this isn't a medicine. This is a vaccine. And what it is that it's a little code, a little message to tell your body to create what we call an antigen to fight off this spike protein. And all you've got is antibodies. And one of the reasons that you advise mothers to breastfeed anyway is because you want antibodies to go from the mother through across the breast milk into the baby. And like Ibrahim said, to provide whatever level of potential immunity that it can provide, or potential protection it can provide from whatever illnesses. And that's why you find a lot of children who are breastfed up until 6 months, they tend to be less poorly until 6 months of age. And then when they stop breastfeeding and they catch everything under the sun, because they've now not got those antibodies being given to them from their moms. So I would say if you're breastfeeding and you can get the vaccine, again, go ahead and get it. I work with a lot of females because, well, that is the nature of medicine. And a lot of those females are breastfeeding, not a lot, but there are some of them who are still breastfeeding who have come back from maternity leave, and some of them who came off of their maternity leave to come in and get the vaccine to go back on their maternity leave. And they're fine, their babies are fine.
All right. Anything else to add for now, Hamish, or should I go into the questions?
Just a couple of things. One, I see I got a message from Shannon about special needs people. So just to say, the good news is that the policy has changed, and as of 15th of February, all individuals with learning disabilities register have been invited for vaccination. So that's something I wanted to say. And just in terms of just a couple of quick takeaways, there's evidence to show from millions of people being vaccinated that the vaccines are safe and that they reduce the likelihood of being sick with COVID-19. There's more recent evidence to show that the vaccines also stop you from being infected with COVID-19 and transmitting it. So the best possible way to protect yourself, your family, your friends, your loved ones is through vaccination. And just for the time being, adhering to those principles around washing your hand, using the face covering when indoors and you can't distance. And when you're out and about, keeping that 2 meter space from people who aren't in your household.
Okay, so a couple of questions from people, ones that we didn't quite cover. Hopefully some of them are quick ones. Some of them, as is the nature, might go a bit longer. So a big one that I think from our community, of course, we try to encourage a healthy lifestyle, eating well, taking, your spirulina, and, those sort of things as well. Some people have asked, why is it being pushed that it's a not magic pill, but a magic jab versus healthy eating, exercise, this sort of thing. So if any of you would like to respond to that, because, it's in our community that is something like try to stay away from putting stuff in your body, just be natural, eat good, eat ital.
I can talk.
Go ahead, Ibrahim. Go ahead.
Not all at once. I see Claudine also when ready.
Go ahead, Ibrahim.
Well, yes, I think one has to look at health as a holistic thing. So when you look at the public health messages, now we have the COVID pandemic. That is one particular situation. If you look at it as your house, if you have a problem with your boiler, you need to put, your attention to get that sorted out. But that doesn't mean that you stop cleaning your house or don't look after your dishwasher. So it's a holistic thing. You have to look at your whole body. So the public health message still, especially to the Black and ethnic minority community, but to everyone as well, is to really, you have to stay fit. So to survive the virus or any virus that might come in future, you need to be fit. So we have to tackle obesity, diseases like diabetes, high blood pressure, exercise regularly. So you do your own bits. These are called things that you can modify, or modifiable health parameters. You cannot modify your age, you cannot modify your sex, you cannot modify your family history. So, but the other things you can modify, and I think you have to look at your health as a holistic thing. So the coronavirus vaccine, yes, it is a silver bullet, and I think it's going to do a major thing in getting us out of this pandemic. But you have to still continue looking after your health and doing all the right things to make sure you stay in a good state of health, and that will prevent more long-term problems.
Right. So to just to I guess expand slightly on that, like again, we get information from various places. So someone may say, I've heard that if you take garlic and turmeric, or if you take spirulina, or various things, would you say there's any truth to that, like that? Maybe not instead of the vaccine, but in addition to, or I don't know. That's the question generally.
Well, I can comment on that, or Hamish to.
Yeah, I'm again. So just to say, I agree with what Ibrahim was saying in terms of anything you do to keep yourself physically or to increase your fitness and increase your level of health is a good thing generally, not just for COVID-19, but for a number of other health outcomes. So what obesity is a risk factor for severe outcomes from COVID. So I would argue indirectly that yes, part of the measure is part of the advice is to reduce the likelihood of being overweight or obese. So that is it's kind of indirect, and the reason why the advice is about washing hands and keeping distance and wearing face coverings is because COVID-19 is spread by a respiratory virus and is spread through droplets that we express when we cough, when we sneeze, when we laugh, if we talk, So that's the reason why the focus has been on interventions that reduce the likelihood of being in contact with those infected droplets. But at the same time, so you'll know the UK Prime Minister was hospitalized with COVID, and he is or was overweight, and he has expressed that is part of the reason why I think he had a bad case of COVID. So as part of that, there was a campaign in the summer to address high rates of obesity. And certainly around Brixton, I have seen public health messages to talk about exercise and diets and so on. So it's happening, but it's not branded as a COVID intervention. It's part of that part and parcel around you do the right thing, you ensure your diet is right. Those of you that believe ITIL is vital, that we endorse that as well. Anything to reduce your likelihood of being overweight, obese, being diabetic, or getting heart disease, I think is a good thing ultimately, both to reduce your risk of severe COVID and for a number of other outcomes.
Okay, thanks.
Good. If I can just interject. So I struggle with questions like these or with topics like these because, well, I get them from my some members of my family sometimes as well. Because no, it isn't magic. It isn't magic. We don't think that the vaccine is magic. We think that the vaccine is science. What we're doing, what we're trying to achieve, what we're trying to prove, or what has been proven is scientific. It is not that we are saying that we've added eye of newt and tail of rabbit. We are saying that there are millions and millions of people that have been vaccinated against this disease, and these millions of people are protected, and we know that because of XYZ reason. I think there's a false understanding of what food can do. I see a lot of posts about if you eat XYZ, it will prevent cancer. Or it will cure cancer, and this will cure HIV, and this will. Food and eating healthy and exercising is absolutely vital, and it is fantastic. But it cannot. Your immune system is built the way it's built and functions within its your own individual range. So it cannot be, you can't go from the optimal functioning of your immune system to somehow all of a sudden being able to cure illnesses because you've changed the thing that you've eaten. That isn't the way it works. What the vaccine is doing is giving you the ability to build these antibodies, or when I describe it to my patients, I say things like that they're building little soldiers to fight off, the disease, and the disease is like the war and those types of analogies. But the two things, while going hand in hand, are still very distinct entities. And having one and doing one well, eating well, exercising well, does not eliminate the benefits of the vaccine. And I think that needs to be clear.
Thank you. Good. I know we've covered already, Hamish, but a few people have asked this question. I just want to make sure we have it as clear as possible. So I'm just going to sort of read from a question we had. I've heard taking the vaccine, it stops you from spreading it. It does not stop you from spreading it. It just stops you from getting very sick. Is this true? Has this changed? It is, of course, now I guess, according to, you said December 8th, it started being administered in the UK, so you have 3 months of time to maybe have some info.
So again, the key thing is the clinical trial evidence was looking at the likelihood of the vaccine preventing against being sick with COVID. So the clinical trial evidence has shown without a shadow of a doubt the vaccines are safe and they reduce your likelihood of being very sick with COVID. What they didn't show was whether it reduced your likelihood of being infected with COVID, potentially asymptomatically. But we just have data from the 40,000 healthcare workers that clearly demonstrates a reduction in both asymptomatic and symptomatic COVID. So what that means is we are now receiving real world evidence that shows an 86% reduction in being infected with COVID, the virus that causes COVID-19. So in other words, that question is a good question, because if a month ago, if you asked me that question, I would say we have to wait and see. But now the answer is yes, the vaccine. And the vaccine I mean here is the Pfizer vaccine has been administered before the Oxford AstraZeneca. So that evidence is based on primarily on the Pfizer vaccine, but there's clear evidence that it's reduced your likelihood of catching COVID.
So what you're saying is we probably need a part 2 in a month or two, and we can further.
There'll be more. Yes. Certainly, if there's interest and there are questions, by all means, because we're collecting data all the time, and the picture will emerge given the experience in Israel, in the US, and other countries with mass vaccination programs.
Right. Okay. Cool. So I'm going to hopefully do these quick questions that are a little bit easier, potentially. Maybe for Ibrahim, people want to know, do you always get the same vaccine as a top-up? You get one, do you get the same thing the second time?
So the recommendation is to get two vaccines in the UK, 12 weeks apart. Now, if your 12 weeks comes up and if your first vaccine is available, you will get that. But if it's not available, you will be offered the other one, from what I'm aware of now. So say, for example, I had the Pfizer vaccine, and on the time my 12 weeks are up and my date, and there's no Pfizer available, then I will be offered the AZ, because both vaccines are based on the spike protein of the virus. So very, very similar trigger to the immune response. And on that basis, you can have Pfizer as the first one and then AstraZeneca as the second one, depending on availability. I think that should, that's fine. That's the answer.
Thank you. Okay, maybe a slightly more technical one for Hamish. Can you give for anyone really, but maybe for Hamish, can you give some insight into the use of A, mRNA, and B, genetically modified human embryonic cells in the vaccine? Before we Hamish answers, just some people are asking, it's quite technical. Not everybody wants as much technical information. We do have a site that Hamish is sending through with exactly what's in the vaccines. So anyone who either signed up by email or just drop us an email or DM, we're going to send you those links so you can get the actual ingredients. But Hamish, if you could answer in a bit of a layman's way, I guess.
Yeah, of course, happy to. And just to come back about the mixing of the vaccines, I mean, Ibrahim's right, but the advice is under review, but the goal is to offer people the same vaccine they were offered first, rather than try to mix. And I guess that could happen. Just like Ibrahim said, it's the same kind of body's response in terms of tackling the spike protein. So if it does come down to that, that could happen. And just to say that what people might be aware of, there is a clinical trial that's being done currently to check whether the vaccines could be mixed and still have that beneficial effect of reducing your risk of being sick with COVID. But there will be rare instances, and there should be extremely rare instances where they'd be mixed. So to go back to the questions asked about the mRNA. So mRNA stands for messenger ribonucleic acid. And what it is a bit of genetic code that once it's in our bodies, it it will generate a particular protein, and that protein will then trigger our immune response and generate antibodies to fight off COVID-19, the virus that causes COVID-19 if we catch it. So that's what the mRNA is. It does not insert itself into our genetic code. It doesn't alter our DNA. It simply gets our body to produce that protein to trigger that immune response. And then the other question was about the embryonic cells. And again, there's a link I could send through that. What has happened for the Oxford AstraZeneca vaccine, what's known as a cell line. So a cell line is based on the kidney cells from a legally aborted fetus from 1970 in the Netherlands. The company that's developed AstraZeneca, they've used that cell line in order to develop the vaccine, but there are no fetal components in the vaccine themselves. So when you do these types of experiments and you generate vaccines, you do have to use cells from certain mammals. They could be other animals, but in this case, these were embryonic cells, kidney embryonic cells from a legally aborted fetus in 1970, but there are no fetal components in the actual final vaccine product. So it was used in the research to get the technology and to design it, but it's not in the vaccine.
Right, thank you. Okay, so we're gonna open the floor to some questions. If anybody, just make sure your video and your audio is working all right. So I'm just basically looking through if anybody physically raises their hand and you have any questions, let us know. Okay, I think we have one. Oh, we did. John Scott, do you have a question?
There you go. Evening, everyone.
Evening.
Can you hear me?
We can hear you.
Hi. Okay, so my question was about, first of all, I know the lady was talking about holistic. When I was talking about that, like, what do you do before you take a vaccine? If you're saying it's safe for us to take a vaccine and everything else like that, what are the preparations that you take before the vaccine? So drink loads of water. I heard you have to sleep well the night before. How do you prepare to take this vaccine so that your body does not adversely react to it? Did you hear me?
I can.
Yeah.
Yeah. Tell you. Can you hear me?
We can hear you. Yeah, we can hear you. Answer you.
Yes.
For me personally, I had my vaccine after a night shift. So there was my third night shift running. It was a busy night. My vaccine was at 10 a.m. So I had been up. I couldn't sleep the day before. So I had been up from about 5 o'clock the evening before. This was now 10 a.m. the next day. And I had been up all of that time. I didn't get much water to drink because, well, I was working. I was on a night shift. I went, I had my vaccine. I didn't even have a sore arm. I felt it go in, but that was it. I was back on my night shift that same night, back to normal. I have colleagues who came in and they were on leave and they had their vaccine and they had fever and chills and whatever. So it has nothing to do with what you do the day before or the day after. It is all about your own body and your own body's immune response. So there isn't anything that you can do. There isn't any advice on how to prepare for the vaccine.
Okay. So if you're
at least not as far as I know what we've.
Okay, so for those so people who said they don't want to have it, like I'm asthmatic, but I'm like a mild asthmatic, okay? And I know I haven't had this before, so now I get this injection and then I get a reaction. How do you stop that? That which can put me in a serious position. It's things like that I'm worried about. If I know that I haven't had this thing before, and then all of a sudden I go to get this vaccine, and then it gives me a reaction because I'm asthmatic. What happens then?
Can I answer that? Because I've had asthmatic patients who are similar with those concerns. So the first question I always ask is think about the risk of the virus versus the vaccine. The risk of catching the virus is a lot worse than any vaccine. Two, the vaccine itself has been tested, has gone through trials, and they did the trials, and there have been asthmatic patients. There have been 22 million people now in the UK who've been vaccinated, including asthmatic COPD patients. If you have a known anaphylactic means a very severe reaction to any of the components of the vaccine, which Hamish is going to share a link, then it's best, yes, you have to avoid those vaccines. The Pfizer vaccine, there's a 15-minute observation period after the vaccine where we advise patients to wait and they just observe just in case there are any potential side effects. After that, most people are generally fine. If you're asthmatic, the key risk is, could it trigger an asthma attack? And if it does trigger, which has not been shown to be the case, but if it does, you will manage it as we would manage an asthma attack, i.e. using your inhalers, if you have a steroid tablets. So there are different methods that we would manage asthma attacks, and that will be managed accordingly, depending on which the attack is. If it's sort of a severe allergic reaction, it's access to things like adrenaline, and patients who have severe allergies tend to have EpiPens with them. So we always ask those questions. So before you have the vaccine, you will be asked, have you got any severe allergies, any underlying health problems, any concerns? And individually, you'll be given the appropriate advice. So, but the key message is the virus, catching COVID itself is going to be a lot worse than any vaccine.
Thank you, Ibrahim. Thank you, John.
Okay.
Okay, let's see who's next. Anika, you had a question?
Yeah, I have a question. I don't know if you can hear me.
We could hear you.
Okay. Hi, everyone. I'm asthmatic as well, so thanks, Ibrahim, for clearing up some of those things. But my main issue is that I teach. School is open tomorrow. Bit scared. I do have to get. I live in Beckton. I teach in Grays, so I get 3 trains and a bus. So I'm on public transport a lot. My main issue is that on Thursday last week, I was sent by my manager some self-test kits. So I have to test myself twice a week to go in before I go in to work. My main problem is that based on the advice from Boris and what's going on, especially at my college, students testing is voluntary. So I'm in a classroom with students who could volunteer to not do the test, and some of them could do the test. But I'm asthmatic and I'm in a classroom with people who could have COVID and decide, well, I'm not going to do the test because I don't want to, because it's voluntary. So it just raises all sorts of concerns, because I don't think I'm anywhere close to being on the list to get this vaccine anytime soon, despite being asthmatic, and I also have bad allergies. So I don't know if there's anything I could do or take. And then now is also that hay fever season coming in, so the nose is starting to get stuffy, the throat is itchy, the eyes already start to itch, and so I have that to deal with as well. So I don't know if there's anything you could recommend that I could. I mean, I started taking the antihistamines, but is there anything else? Because I really want to probably protect myself as best as I could, especially seeing the environment, because I do have probably my largest class is 26. And there's no, I mean, I have 2 windows, so there's no ventilation at all. And there's no social distancing because once they stay in their bubbles. But teenagers, they're gonna mix anyway. So we're in a cramped classroom, no ventilation. So it just gets. I really just don't know what was a rush to open schools in the first place. But my biggest fear, as I said, asthmatic, allergies, the hay fever is starting to act up, and I don't think I'm gonna get that vaccine anytime soon. What could I do to protect myself.
So I'll start up, and just to say, I mean, I hear that in particular in terms of the long circuitous commute to get into work, and I completely hear where you're coming from. So the first thing I would say is I guess in a situation like that, what you want to make sure is you're wearing a face covering. Now, again, just to recap, the cloth face coverings are more about what's called source reductions. It's more about if you have COVID and don't know you have it, decreasing the likelihood of spreading it. There might be some benefits of it protecting you from catching it from others, but it's more about you spreading it unintentionally, right? So I would say that's one measure. The second thing I would say is to keep as much distance as possible. I don't know. And the third thing is, I don't know if it's within the gift of the school to recommend. I know the self-testing is not compulsory, but if there's any scope in terms of the school administration strongly encouraging students to do it. So the benefit of the self-test is that they're pretty good. They do have a bit of an error rate, but they concern more is about false positives. So you're going to err on the side of caution, where if you're false positive, someone will stay home and self-isolate. So you don't want false negatives, right? False positives are beneficial in this scenario. So I would say anything that you and your colleagues could do to encourage the administration to encourage the uptake of, I would say, face coverings by the students themselves will also hugely help, and the uptake of that self-testing with those lateral flow devices.
I believe they have said that students must now wear masks in the classroom, but obviously it's quite difficult, as I said, because there's no ventilation, there's no airflow in there.
So, and I imagine you mentioned they have 2 windows, right? With the windows, that will help. Even a little bit of ventilation will help in terms of circulation of air. But of course, we're still in winter, so and that brings its own challenges in terms of keeping the windows open. It might get cooler in your room, but if you can, that's a good idea. And again, I think hopefully you as the teacher will it be within your gift to enforce the use of the face coverings, right? Because that in a situation like that is the best possible means. Keep as much distance as you can and ensure that the students are wearing the face coverings. The last thing I'll say about that is people under the age 16 and under only have, if they get any disease, it's very mild. And people with mild disease, they might have a lower, so Claudine had mentioned viral load, so they might have less virus in their body. It doesn't mean they're not infectious, but they're not as infectious as someone who's clearly very sick. So I would say if you're in a classroom, but you're with younger teenagers, let's say, chances of transmission, they exist, but they're lower than if you're in a room with adults. So again, it's about keeping the windows open and using the face coverings, both for yourself and the students as well.
Okay, thanks.
Cool. Thank you. Thanks, Anika. All right, we're gonna go to Shannon. If you want to unmute yourself.
Hi. I guess what I have to ask is that with now that I know as far as the safetiness of the vaccine, I'm one that has not worked the entire pandemic, being an autistic individual plus suffering obesity and a lot of that kind of, disability issues. What I'm asking is, when you take both of the vaccines, is it safe to return to work? And what I mean by that is, I know many people have different jobs. Sometimes people have office. My job in particular is very different, like what people call like a DoorDash or a Grubhub. So you're in and out of a lot of different like restaurants and buildings and picking up food. It's like being a pizza guy. You pick up the pizza from the restaurant, but it's literally going county by county, driving around into all these different places. Would it be safe to do that after taking the vaccine, under the circumstances of not knowing who you're around and being in and out of buildings that frequently in a day?
So I'll start. And so Shannon, I think that's a good question. So I would say I think the vaccine, I know the vaccine is going to reduce the likelihood of having any severe disease dramatically. there's increasing evidence from the Pfizer vaccine that will increase the likelihood of catching COVID. But for the time being, I would argue if you're out and about in those settings, the same principles that we were discussing with Anika about keeping distance, hand washing, using the face coverings, I would recommend that you still apply those principles when you're out and about as well.
Yeah. Okay. Thanks, Shannon. So we're gonna move on to Royalty P.
All right, I'm unmuted. Good evening, everyone. Similar to, is it Johan and Anika? It seems to me that the people who probably could be affected mainly, like asthmatics, have a big fear of the vaccine. And they, along with asthma, most people who have asthma tend to have a lot of allergies. So what's been done in the studies and trialed in terms of research? What are the risks in terms of those who are asthmatic, those with the many allergies that they may not even have or may not even know they have, or may experience under different conditions? What is the research behind the vaccines, the various vaccines, and how can you reduce the fear that many may have even going to have the vaccine, because you won't know until you get there what vaccine you will have? Sorry, there was a lot of questions, but hopefully you can.
Thanks for the questions. And again, I'll start up and Ibrahim can come in as and when. So I'll start and talk about the allergies, let's say. Actually, no, Royalty P, I'll talk about the very last question. I'll start with that. I think to address misinformation or doubts or uncertainty, it's events such as these. So, big up Chan for putting on something like this. And I think there are forums like these to kind of be open and transparent and share information. I think that's what would help in terms of getting the information out there. The other thing about the allergies is that it's not the, let's say, seasonal allergies and hay fever. There's no risk there from taking the vaccine. And in fact, the only exclusion criteria that has to do with allergies would be allergies to the components of the vaccination themselves. So you mentioned something that people may not know if they're allergic to it, right? And in that case, if I'm not mistaken, Ibrahim, correct me if I'm wrong, everybody who's been vaccinated has to be observed for 15 minutes. And the allergies we're talking about here are serious allergic reactions that require either you to carry an epinephrine injection or to require hospitalization. So it's a kind of a reaction that happens quickly. So that 15-minute observation period is there to ensure that you do not have an allergic reaction. But if you, let's say, have an allergy to seasonal allergies, let's say, or mild allergies, and you don't have to carry an EpiPen, there's no evidence, there's no harms to taking the vaccine. So I don't know if Ibrahim or you want to come in on that.
Yeah, I agree. So for the Pfizer vaccine, there is a 15-minute observation period. And as we know, the most severe reactions, which is anaphylactic reactions, they're fairly instant. They tend to occur within 5 minutes of exposure to an antigen or a trigger. Once you go past that period, then it's unlikely that you'll have a severe reaction. Still, people can react in other ways, and people can develop delayed reactions or delayed allergies, but those can be managed according to the symptoms. And in most cases, a bit like hay fever, you can take antihistamines for certain allergies. But also that's where we ask people to report any symptoms, and that we use either the yellow card scheme in the UK, where you can report all the side effects or symptoms. And I must say, I've had quite a few asthmatics who've had the vaccine. None of them have actually come back to say that they've had an asthma attack or anything has got worse, but it may be different in other areas. So, and usually the triggers for asthma are quite, they're so different for each person. So it's hard to predict. But the key thing is you need to make sure that your asthma is well optimized. If you have severe asthma, you need to discuss with your own doctor to see how you can control your symptoms, because that is the key. And make sure that you have a plan for your asthma as well, how to manage reactions, how to manage allergies and in how to use your inhalers in the event of an exacerbation. Did you want to say something? Okay.
Thank you, Dr. Ibrahim. Also, and Dr. Hamish as well. Sorry. Also, what I was saying in terms of allergies. Sometimes allergies could be towards certain medication, maybe not specifically to do with your asthma, but like, for instance, I'm allergic to ibuprofen. Will I know what's in the drug, what's in the vaccine before I get to the chair, before I get to the chair? And what are they saying about the clause? Because we're hearing a lot about the yellow card system. You're relying on people to report back after they had the vaccine. We understand that there's a clause that was put in onto the government website that kind of was a disclaimer from the government if anyone was to become sick from the vaccine. So are we having to wait until something happens before we hear what happens to other people? Or, that was my general question in terms of the clause as well.
I'm not sure. Royalty is I am actually asthmatic. I'm asthmatic. I have hay fever. And anytime I catch a cold, like, I'm the person who, if they catch a cold, somebody sneezes on me, 3 weeks later, I'm still coughing and I want today. Like, that is my life. I've had my vaccine. And I get this question a lot from parents about what if my child has an allergy. And I think there needs to be a separation between what is a vaccine reaction and what is an allergy. So the allergy that we're looking for is something called anaphylaxis, which is where your throat closes up because you've got swelling in your throat and you cannot breathe, and it is life-threatening. If you have not had an anaphylactic response to most vaccines, if you just have an allergy, like, let's say, there was, before they were talking about if you had an allergy to eggs, you couldn't take certain vaccines. And now the advice has changed that if you have not had an anaphylactic response previously, then actually you can have the vaccine. So if your question is, what if I have an allergy to something that I don't know about? The premise with allergies is very similar to the premise with the vaccine, and the reason why we want people to get the vaccine, which is you first have to have the thing introduced to you. So you get the ingredient, then your body's like, oh no, what's this? We don't like this. We need to fight this off. So you then build the antibodies, and then so the next time or the next few times that you get exposed to that thing, the illness, the allergens or whatever, then your body can respond more quickly and more severely, which is why you often end up with an anaphylactic response. Can you have anaphylaxis from a single exposure? Yes, you can. How likely is it? Extremely unlikely. And again, that's why Ibrahim said that's why you wait. Because if you're going to have anaphylaxis, it's going to be almost immediate. And there'll be somebody there with adrenaline to stab you in your thigh if you get that kind of reaction. I see your face. But, and I'm being a bit facetious, but what I mean is there will be somebody there who is trained to administer that treatment in the unlikely but unfortunate event that does happen. Sorry, I forgot the other part of your question, Lord.
Can I just come in, Claudine, in terms of how rare it is? So that there is data on how rare the anaphylactic reaction is, and it's 0.0001%. So that means for every million vaccinations, 11 people might have that severe reaction. It is really severe and it requires immediate action. So I'll pass back over to Claudine.
Yeah, what was the second part of the question again? Because I forget.
Oh wait, I think it was royalty. Pete was about the liability issue. Yeah. So I'll start up, and I think this question in previous discussions had come up, and looking at that Gov.uk page, it's about use of unlicensed products. So that's not an issue here because the 3 vaccines are approved and they're currently approved by the regulator and they are licensed vaccines in the UK. So in other words, I'm just trying to kind of find on that Govlet UK page what the liability issue. So it's about.
While you look, Hamish, I'm just going to jump in a second. We actually have a lawyer who took the vaccine, and she's actually running another Zoom. Well, not this sort of Zoom, but she's running a different Zoom. So she should be popping across in a little bit. But she, she took the vaccine, and in her opinion, it was fine to do so. Hamish is going to talk to that question from Royalty about I guess people have been hearing whether you can be compensated and this sort of thing, but she said it was fine for her. But I don't want to speak in turn for her, but she should hop across in a little bit.
Yeah. So just briefly, the Govlet UK page is a consultation document and it's referring to unlicensed medical products, and the vaccines are licensed. So it's not an issue. This is not an issue. And of course, the vaccines have been shown to be safe. We're collecting data day in, day out. Ibrahim's mentioned the yellow card scheme as well. So there's information and data from tens of thousands of people who were in the clinical trials last year. And we're also collecting data from so there's 21 million people, 22 million people that have been vaccinated thus far, starting on the 8th of December.
Thank you, Royalty P. All right. So we do hope that our lawyer, colleague, and friend who took the vaccine is able to jump across. I know she's on that other call. If not, we will at some point be able to let her speak to you guys as well. So we're going to head across to Soca Overdose. Just 2 more questions, people. I think, the guy's been here for a while, so I think 2 more questions, then we'll wrap up.
Yes, thank you. Good night. Excuse me. Yeah, I miss most of the Zoom. So I don't know if you all spoke about this, but my question is more on long-term effects, I guess. I'm not sure if you all spoke on that.
Okay, thank you, Soca Overdose.
Yes, I think we talked about the long-term effects. There were 2 different long-term effects. One, you have to ask what are the long-term effects of the virus, and 2, what are the long-term effects of the vaccine. So far from the trials, there hasn't been much that has come out of any long-term effects of the virus through the 3 phases of the trial. There is still long-term, what they call the long-term surveillance of vaccines that can still be going on. So potentially the risk of the vaccine is a lot lower than catching the virus. That's always what you have to think about. Short-term effects have been known. You might get an ache in the arm, feeling tired, headaches, but maybe a bit of a fever. But after 2 to 7 days, most people recover fully, and there have been no known issues. There may be a few rare things that may happen, and people are reporting these either to their doctors or to a scheme like the yellow card scheme that we have in the UK, and I'm sure there are similar schemes by each country as well. And I think with time they can compile some of those things, but so far we're not aware of any long-term effects from the vaccine, and it's unlikely that there will be much of that will come in the near future until we get a lot more information. But rest assured, the vaccine is a lot safer, and the long-term effects from the virus is the main worry. You're muted.
Thank you. Thank you, Soca Overdose. I think we're going to take a last question. I see one more person here who has their hand up. We cannot hear you now. You are unmuted, but we're not hearing you. Still not hearing you. Maybe if you plug in headphones, there'll be a microphone on your headphones.
Can you hear me?
Yeah, we hear you now.
Okay, sorry about that. I just wanted to ask, it's probably not about the direct impacts of the vaccine as useful information all the doctors have given today. I wanted to ask about, I was reading about COVID or vaccination passports. So, you know, implementing trials whereby people have to show that they've had COVID vaccines to be able to go into restaurants, bars, travel abroad, and other things like that. Now, I've heard a couple of things that you guys said about, you know, Afro-Caribbeans and ethnic minorities maybe not taking the vaccines as much as everybody else. I'm kind of thinking, would that push more inequality in this country? Would that mean that, you know, if I choose not to take the vaccine, I'm then somebody who can't go into certain places and is even worse off by it? So yeah, I don't know if that made any sense, but it's just the last question that I thought I'd pose, since you guys are the professionals.
I think that's a fantastic question. So there are two things there. One is the early evidence suggests that the uptake of the vaccine is lower in Black people first. The second thing is about COVID vaccine passports. What the government has said is that they're considering COVID certification. And COVID certification means showing that you've either had the vaccine, you've tested negative with the vaccine, or you've been tested for antibodies and you have a high antibody response. So they're evaluating that from a legal and ethical perspective to see if they could do that in the UK. There are other countries that are introducing a requirement to show vaccination on arrival at their border. And Israel has implemented a policy whereby you have to show vaccination to access gyms and clubs and what have you, right? So different countries are doing different things. The UK is more, again, there's no mandatory vaccination here, and the certification is 3 different things: the vaccine or a test being negative or showing evidence of having had COVID before, because many people would have had COVID and not shown any symptoms. Now, I think that point about the inequality, it will manifest in 2 ways. One, you could be in a situation where if Black people are less likely to take the vaccine, I don't know yet how it will manifest here in the UK, but what we're at serious risk of is, you remember I said at the start that we're out of sync based on the population percentage. We're 1% of the population, but 2.5% of the deaths. That proportion will increase if we're not vaccinated. So what we might be in a position is that if vaccine uptake is worse in Black and brown people, that proportion of deaths that they contribute will increase because other parts of society will be more protected. So I think that's a really important point, that we're at what COVID has done is shine a light on existing health inequalities and societal inequalities. And we're at serious risk of that becoming worse if vaccination uptake is lower in the Black communities.
Looks like Claudine wants to add something.
I agree with, please forgive me if I butcher your name. I'm gonna guess it's Alozi. I agree with you wholeheartedly. Like, these are things that I worry about, because we know from reading the news, from reading BMA articles about the fact that the uptake of vaccines in people of African heritage who are even working in healthcare is less than that of their white counterparts. And that speaks to a greater distrust in the Black community than whites and than our Asian counterparts have had to have. We have historical reasons for having that distrust of the government, of healthcare, of pharmaceutical companies. And we understand that there is a basis for that. And do I worry that this will now cause us to have to be discriminated against more? People who didn't previously have an excuse for it are going to use this government, what they would consider government backing, to refuse us entry into places that we should be allowed to go. Yeah, I'm terrified about that, if I'm being very honest. I think that that is something that can potentially happen. And I'm hoping, though I also don't have a lot of faith in government, if I'm being very honest. I am hoping that that will not be the case. I am hoping that because of 2020, because of the things that were brought to the surface regarding racial inequalities, because of the Black Lives Matter movement, because of all of these things, I am hoping that that will somebody who is a power that is will highlight the possibility of this becoming an issue and prevent it before it starts. Like Hamish said, it is by no means a done deal in the UK, but can it happen? Because Cyprus is now demanding that you produce evidence of having had your vaccines. If you want to go on holidays, and we all like to go on holidays, yeah, that can happen to us. Airlines can use it as a way to discriminate against us, and it's worrying and it's sad. And what I feel personally is that I feel like the uptake in our community is less than everybody else's community because nobody's speaking to us and speaking to the things that are really, to the reasons that we're worried. I know that, sorry, I just lost my train of thought. Yeah, I know that there's a lot of like misinformation going about the place, but the reason that there's misinformation going about the place is because we have learned to not trust what the government tells us. It's because we have learned to not trust what healthcare providers tell us. And the reason that we're doing this today is because we're hoping that perhaps if you see us, you see our faces, you know that, we in mass, we DJing, we out here doing, sounding like me, sounding like Hamish, like Ibrahim. We are one of you and we want the best for our people. Like, we are hoping that that can help to bridge that divide between healthcare, government, and our people. And hopefully it will help us to stay healthier. But can that happen? Yes, it can. Hopefully it won't. Fingers crossed.
Thank you. Hopefully that answered your question. Okay. So guys, I think, we've been on for 90 minutes extra. A lot of people were at home, of course you got a chance to have your food and so on. Of course, our speakers here today, thank you very much for coming out. I don't know if people in the audience think it's worth having a part 2. That's something that we could decide. I think some of the speakers are keen on doing so if you guys think it's good. Hopefully we covered most, if not all, of your questions. As you would know, we had a lot of questions, so we couldn't cover absolutely everything, but hopefully we gave some information to help you make an informed choice. Speakers, if you have any last words to say, feel free to do so now. I don't know who wants to start and do that before we depart from this part of the evening.
Okay, I can go first. I'd like to just say thank you to everyone for joining in. It's really good and nice to see everyone in here, so many people, and really, really good questions. And I think what we need to do is to address this. I'm a healthcare person. I work as a doctor all the time. I give advice to my patients. But then again, I go out, I go fetting, I go to carnival, I do everything else. I'm a normal person. It's just the one important thing for me is that I would wish for myself, for my family, for my friends, the best, and I will not give wrong advice. If I know something is not right, I'll have my reservation. So, and I think that's what we need to do, especially in the Black and ethnic minority community, that we need to come out more. I think there's a lot of negative messages going out. It's a lot easier for people to put posts on social media about negative things, and the good things, we that are actually involved in healthcare are not saying much, or even everyone, I want someone who's got asthma to come out and talk about their experience, put a post on Instagram, put a post on Facebook about how your experience is with the vaccine and how your experience is with the information. Give good information out. We talked about, it's like complaints, when you have a good service somewhere, you go to an airline, you have a really nice experience, you don't go back to feedback. So most of the things that you end up getting are the negative things. So the reviews tend to be negative for everything. But actually, when you listen to experts, but also listen to your friends who are into that field, and they're in the best position to give that advice. I am available, of course, if anyone wants to reach out to me to ask any questions, feel free to. I can tell you a lot about the UK vaccine program, which I'm involved in. I'm really happy to be here.
Thank you, Rim. Thank you for participating. Claudine or Hamish?
Okay, so I'm happy to go next, and just I think I echo a lot of Ibrahim's sentiments. I think I appreciate the fact that many of you have given up your Sunday evening to join in and hopefully dispel some myths that have been circulating about the COVID-19 vaccination. So again, it's, as I said at the outset, we're fighting another pandemic, and it's a pandemic of misinformation that's spreading. And, forgive the pun, but a lot of this stuff goes viral, right? So a lot of misinformation is spreading on WhatsApp. I would ask all of you to please check the veracity of what you receive and think before you forward. If you have any questions about the content of your posts, then I would say put in those search terms and add something like PHE for Public Health England, or WHO for World Health Organization, or CDC, so you can find an official source. There are a number of resources, and I'm going to send through some links to Mark to forward to those of you that have registered as well. So COVID-19 is the pandemic of unheard of proportions, if I'm being quite frank, but vaccination is the way out of it, and it's the best possible intervention we have to protect us and to protect those we care about and to resume some state of normalcy. So Mark, thanks for inviting me to speak here, and thanks to all of you for tuning in.
No problem. Thank you, Hamish. Claudine, any last words?
Thank you for giving me this opportunity, first of all, and thank you everyone who's been stuck with us through this long chat that we've had. I think if I had anything left to say, it would be to echo the sentiments of Hamish and of Ibrahim, which is find reliable sources. Most of us know at least one buddy who is in healthcare. Speak to that person. Please do not rely on random internet site, random Instagram page for your medical information. And that is not to say that they don't have, that there isn't endless really good information on Instagram. There are so many doctors on Instagram and on social media, but please find those people. I want to also say that I understand all of the hesitancy. I understand the distrust. I understand the frustration with the government, with healthcare, with all of it. But in that understanding, one thing that I said some time ago when I did a live with Know Your Caribbean, I said our bodies have been used for a lot longer than they should have been without our consent for medical research. Our bodies have been used for the development of so many of these drugs and these vaccines. And we are now allowing, because of the distrust that has created, we're now allowing the groups of people that used us in that way, that use our bodies non-consensually, to benefit from the things that we were used for. And if there's no other reason to do it but that, if there's nothing else to reflect on but that, I'd say, think about that. We cannot be the ones, the last ones to benefit from the things that our ancestors gave their lives for. So please just remember that, and be safe and be careful.
Thank you, Claudine. Thank you to all the speakers. Thank you to Shep and Rascal as well. I'm seeing in the chat we have like 20 something more questions, but of course we have to cap it at some point. You know, we've already gone over about an hour and a half and everybody's hungry. I know, you know, it was formal but informal. So, you know, it's all good if people were eating or doing whatever they wanted to do while we were here. It's all good. We're family in that way. So thank you again to the speakers. Possibly we'll have a part 2, so let us know what you guys think. And again, you have the links in the chat if you want to either email Just Vibes or DM Just Vibes, so we can send you the links and information from this evening.